Right, wonderful. Welcome, everyone. I'm excited to do this Master Brain Health Zoom presentation with you all today. I think this is a topic that's really on the forefront of people's minds, just with heightened levels of anxiety and depression, brain fog, forgetfulness,
Can't hear anything.
rise in Alzheimer's and dementia as well. And so I'm seeing a chat. Oh, sorry, Cindy. I'm sorry I can't hear anything. I don't know. Seems like everyone else can hear me. So I'm not sure how to help you troubleshoot. Bear with me here. So I know some new faces. Those of you who don't know me, my name is Sophie Alexander. I'm a clinical nutritionist and owner of the Nutritional Center in Ithaca.
What is wrong here?
Hi, Cindy. I can hear you. So if you don't mind muting, just so you don't mute yourself, so you don't mind. I'm going to mute you actually because I want it not to interfere with the recording. But it sounds like there's something going on your end. Yeah, so I have been doing the work of clinical nutrition and nutrition response testing since started on my own body in 2019, and it was really because of my own health concerns, dealing with chronic Lyme issues and chronic digestive issues that motivated me to study nutrition and become a practitioner myself. And I have just been hooked ever since. This is something that's really grown as I've seen myself through my own health journey, and then of course helping so many different clients through their own health journeys. And now, further down the road, as a mother of three, a business owner, keeping my brain healthy is something that's very much on the forefront of my mind, and I'm eager to share everything with you that I've been learning and putting into practice. So some background, the most common mental illness in the United States is anxiety, which affects 40 million adults, about 18% of the population. And I thought this fact was unfortunate, that over 50% of lifetime stress in the form of depression and anxiety begins by the age of 14. And that by the time we're 24 years old, it has increased 75%. So I think there's a lot of talk about chronic stress and how that impacts health, how that impacts healing, how that impacts the brain. And I want to really educate people and also be proactive, because there is so much that we can do besides, oh gosh, you need to handle your stress better. Right? There's so much we can do to be proactive. Because anxiety and depression and other mental health conditions are complex disorders with many contributing factors. And you're going to hear me talk a lot of this talk is focused towards these facets of brain health, but you can extrapolate. You can extrapolate and say brain fog or memory loss. Take it further and talk about dementia and Alzheimer's. They all have these underlying connections, and the tools that I talk about and share today can be applied to that as well. So if you're experiencing any kind of mental health challenge, sometimes people are told it's all in your head, or just get over it, or you gotta handle your stress better. But it's far from the truth. There are so many factors that are contributing to this happening in our bodies. And as I find, there are many reasons someone may experience stress, anxiety, and depression. And what we have discovered, really, and what's key with nutrition response testing, is that anything can cause anything. And what we need to find out is what's causing it for you. And then that helps us figure out how we turn it around.
I don't know what's going on.
Hi, Cindy. I'm sorry you're struggling. I'm not very technologically adept. I don't know how to help. I saw you re-enter the waiting room, and that's great. and I can hear you, just so you know. And I would let you back in, so that's good. Just make sure nothing's muted. Yeah. All right. We keep moving along here, though. I'm just gonna send Cindy a chat back since she's not hearing anything. I just realized that she can't hear me and hear my responses to her.
I don't know why.
Okay. All right, we're troubleshooting here. Unfortunately, trying to help Cindy. I'm trying to send Cindy a message, and it's saying she's not even in the meeting. Okay, try it again. All right, I'm just going to send a note to everyone in the meeting to see if I can send it to Cindy. All right. Okay, so I just wanted to give some definitions. And so with stress, anxiety, and depression, stress is being overwhelmed or unable to cope with mental or emotional pressure. Anxiety is feeling tense, nervous, or unable to relax and have a sense of dread or fearing the worst, the feeling the world is speeding up or slowing down. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. And I see a lot of these health concerns tie back to brain reserve and each individual's level of brain reserve. So your brain reserve is a level of structure and function, which when the body falls below the amount of brain reserve that you have, symptoms of brain dysfunction start to occur. The amount of brain reserve of a person can vary for different parts of the brain and depends on age, genetics, neurotoxin exposure, nutrient deficiencies, and electromagnetic field exposures. So if you're not familiar with what electromagnetic field exposures are, that is the low-level radiation that ends up coming off from our computers, our cell phones, cell towers. There can be an accumulated load that can really contribute to mitochondrial stress, brain stress, depleting this reserve, right? And then depending on whether there's other factors too, how old you are, your genetic makeup, whether you have any nutritional deficiencies, whether you've had any toxin exposures, you can see how the level of brain reserve quickly starts to get depleted. And then symptoms start to occur. So can neuroinflammation cause stress, anxiety, and depression? I would say absolutely. So what is neuroinflammation and what causes it? So neuroinflammation is when the brain's innate immune system is triggered following any kind of an inflammatory challenge. This can be from like an injury, like a concussion, right? An infection that the body experiences. As I was just mentioning, exposure to toxins, especially pesticides, especially glyphosate, which is on Roundup and is just so prevalent in our food supply because it gets used so much in conventional farming. Mold toxicity, and I'll be talking more about that in a moment. And then when there's neurodegenerative disease, and then the overall aging process. So how does mold affect the brain? It very much does. There are some types of mold that produce toxic substances called mycotoxins. Right? And so if, unfortunately, if someone's been living in a moldy house for a long time or spends a lot of time in their car, has a moldy car, these mycotoxins can start to dominate different parts of the body. They particularly like the brain, they like joints, they like the liver, and they accumulate and cause damage by interfering with metabolism. They interfere with mitochondria, which are our powerhouses of our cells that make our cellular energy, and induce inflammation. And I find this often in my work with nutrition response testing. I'm able to identify the mold. I'm able to see where it is in the body. And I very much see clinical connections of people struggling, particularly with depression, when there's a deposit of mycotoxins affecting the brain. But memory too. Yeah, memory is a big one as well. When folks are dealing with that, it might not, it can affect their mood, but it also just a high contributor to brain fog. So toxic mold exposure has been linked to more serious long-term effects: memory loss, insomnia, anxiety, depression, trouble concentrating, confusion, weakness, light sensitivity, sinus problems, blurred vision, tremors, and a general feeling of numbness. And it can be a tricky one because it can be silent, right? And you just don't know. But if you have a wet basement, if you've had any water damage in your home, it can be there. Yeah. And so if you're struggling with these types of health concerns, having a mold remediator come and look for it can be a huge step and very helpful. And then also working with someone who does nutrition response testing to be able to help you identify it and help your body clear it out is also vital. Right. And so a little bit more about harmful chemical exposure, because I see in my practice, this is the growing dominant issue. Like I've been in clinical practice for over 10 years, and the burden on people's bodies with chemical exposure has just been growing and growing, and has been a bigger and bigger barrier that I need to help bodies overcome so that they can be well. So harmful chemicals have been shown to disrupt or downregulate over 270 enzymes in mammals and upregulate over 30 enzymes. So when these enzymes are involved in mitochondrial functions, problems can occur in all sorts of different organs and tissues that use energy, right? And the ones particularly that need the most energy. So your brain, the kidneys, your liver, the heart are most infected. And then this contributes to immune suppression as well, because the communication in our body is done with chemistry. So when there's disruption of enzymes or cell signaling ability is turned off or turned incorrectly on, right? What happens is that the body's tools for protecting the body from reactions goes out of control, right? And there's a lot of tissue damage. As I mentioned earlier, the biggest one that I see, and the one I think is just most prevalent, is the glyphosate, just from sprayed on corn and soy and wheat the most dominantly. And I would say is the biggest reason why there is such wheat sensitivity in this country particularly, but it's in so many other foods as well. And that's why it's so important to be buying as much organic as possible. And when not possible, consulting a list put out by the environmental working group called the Clean 15 versus the Dirty Dozen. So the Clean 15 are the foods when conventionally grown use the least pesticides, and it's okay to buy conventionally. And then the Dirty Dozen are the ones that are the most heavily sprayed and most important to prioritize buying organic. They have a great website in general with a lot of really helpful health information about water and skin beauty products and foods. I also want to touch upon the gut-brain connection, because I see this as a very significant reason when people are struggling with anything with brain health. The brain has a direct effect on our stomach and intestines. For example, the very thought of eating can release our stomach juices before the food even gets there, right? But this connection goes both ways, and a lot of people don't realize that. troubled intestine can send signals to the brain, just as a troubled brain can send alerts to the gut, right? And so when I see people struggling with imbalances in their digestive tract, whether that's, an overgrowth of certain bacteria or parasites, or imbalances bred from toxicity exposures, that very much can be a contributor, particularly to anxiety. So what damages the gut, right? As more chemicals are introduced into the food supply, we are seeing higher levels of diagnosed neurological disorders. So chemicals directly block bacterial pathways that are happening in the gut that contribute to our neurotransmitter levels, right? And this lowers our neurotransmitter levels, which then contributes to destabilizing the brain function. A lot of people don't realize that there are more neurotransmitter pathways, particularly for serotonin, which people think of as, the happy neurotransmitter in our digestive tract than there are actually in the brain. So there are over 80,000 chemicals registered for use in the United States. And very little have been studied on the long-term effects on humans. Chemicals have been found in newborns' placenta and umbilical cord. Kids come exposed from utero, right? Children get an exposure from their mother. They know whatever the burden on the mother's body, children get exposed to that. And then they come into the world or already dealing with a toxic load. And I have witnessed this, in my own children too, even with all the work that I did on my body before getting pregnant and really working to be careful. I've been shocked to the chemicals that I've picked up on in my own children with the nutrition response testing, and just what a customized detox program they've had to be on at young ages. So these harmful chemicals, they lower our neurotransmitter levels, and these neurotransmitters allow for normal feelings and emotions. So low levels, or the ability to make expected levels of neurotransmitters, is primarily the cause of different diagnoses like ADD and ADHD, anxiety, and depression. And so now I want to talk more about the lymphatic system. Many people haven't heard of it. This is another really important aspect of having a healthy brain, is having a healthy lymphatic system. So the lymphatic system serves as our brain's front-end waste drainage pathway, connected to our downstream lymphatic network, right? And the lymphatics are a major way of our immune system response and our cleansing pathways in the body. So let's learn about sleep in the lymphatic system. The lymphatic system is constantly filtering toxins from the brain, but this system is mainly disengaged during wakefulness. So interesting. Sleep is the primary driver of lymphatic clearance. So when we don't sleep, and I say many of us have experienced this, right? If you don't get a good night's sleep, or you pull an all-nighter, your brain doesn't work as well, right? Because sleep is for clearing the brain of the potential neurotoxic waste products that accumulate during wakefulness. So, we know about these, if you pull an all-nighter, right, you don't think as clearly, but the unfortunate is this low-level sleep deprivation that happens for so many people, that you're able to function, but not to the level that you can, right? And also, you don't realize is that with this low-level sleep deprivation that's so the majority of people deal with, I would say, how much that contributes to the ongoing further toxic buildup in the brain, which then down the road, leads to more of these diagnoses or development of disease. Because most people go to sleep too late, don't get enough hours, have very disrupted sleep, just don't practice good sleep hygiene, and I will speak more about that but yeah, I'll speak more to that now. Because it's vital to develop better sleep habits for brain health. So that means establishing regular sleep times, particularly sleep times that fit in with the body's circadian rhythm. So our bodies are designed, to be quieting down, going to sleep as the sun is setting. So winding down activities in the evening, not having a lot of artificial light on, not having a lot of screen time, or if you do, blocking the blue light that comes from the screens with blue blocking glasses, and committing to a regular sleep schedule. Like for our circadian rhythms is optimal, is winding down, being in bed at 10 p.m. And getting some key sleep before midnight. There are ways to adjust diet that aid sleep. Absolutely. I mean, eating late in the evening does not help our sleep cycle or sleep patterns, nor does it help our metabolic health. And then, of course, there's so many stress patterns, thought patterns. A lot of people struggle with settling down and falling to sleep, and that can be driven from their thought patterns as well as just the cycle of their stress response, right? So that can be addressed from that can be addressed from a nutrition perspective, but it also can be supported from a stress response in things like these meditation apps. I have so many clients have found those to be so helpful, where they're listening to something or doing a very specific meditation that aids them in quieting the brain and falling asleep. All right, so I want to get into some natural ways to support brain health, mental health. It's some of my favorite tools that I want to go into. You can support your mental health with herbal support, which I'll be talking a lot about in a moment, mindfulness techniques and nutritional strategies. I find these all together are very successful in boosting the body and helping the healing process. So mindful techniques, this is not my area of expertise, but these are things that I have personally witnessed and used. They are even just little simple steps, right? Stop what you're doing, stop yourself in the moment, put things down, take a breather, take a deep breath, and shift gears to move you out of that like stress going mode, and making it a habit for yourself to catch yourself and step away. And walking is a big one, as something to shift gears, do something different. Regular walks have been shown to lead to lower levels of depression. Some of these studies suggest that 3 45-minute walks per week is the perfect amount. Other research shows that walks should be taken with people, that it's the social aspect of it as well, the communication, the sharing time with others. And especially if you're not up for any other types of exercise, walking is an amazing form of exercise, and can really help support the lymphatic system, thus supporting the lymphatic system, gets you outside, which helps reset your circadian rhythm. Because one of the ways of optimizing your sleep and optimizing your sleep and changing up an unhealthy sleep pattern, is getting outside, seeing the morning light, seeing the midday light, seeing the evening light, and walks can really help with that. And now let's get into some herbal support. So clinical research has found that herbal and nutrition support is useful for addressing anxiety and other mood-related conditions and optimizing brain health, without risk of major side effects. And this is what I use every day in practice and on myself personally. So some of my favorites are passion flower, St. John's wort, valerian root, kava, chamomile, ashwagandha, and skullcap. And I will be talking about those in some formulas in just a minute. So in terms of nutritional strategies, well, a healthy, well-balanced diet for sure helps us think more clearly and feel more alert, can improve concentration, attention span, can reduce anxiety, can improve depression. It's incredible. Conversely, an inadequate diet can lead to fatigue, impaired decision-making, slow reaction time, anxiety, depression. It goes both ways. So, and so much of it has to come down to how you manage your blood sugar. There's a really great new book out called Glucose Revolution. Can't remember the name of the woman who wrote it, but it's such a fascinating dive into blood sugar and tools for really keeping your blood sugar steady and how much that impacts your health. And this is something that we're teaching people constantly because we see it tied to so much chronic disease. So a fundamental, besides telling you eat this, this, and this, a fundamental is to avoid foods which make your blood sugar rise and fall rapidly. So this is sweets, biscuits, sugary drinks, refined carbohydrates, such as white flours, vegetables, which contain a lot of minerals, vitamins, and fiber, and this is what's needed to keep us physically and mentally healthy. So eating a variety of different colored vegetables every day means you get a good range of nutrients. Also, getting a good amount of fat and protein, and particularly the category of what I call healthy fats, which are your butter and ghee and avocado and coconut and pasture-raised animal fats and olive oil are so nutritive and important for good brain health. And so when we want to boost serotonin levels naturally, right, because deficiencies in serotonin, which is a certain transmitter, are common in major depression, we can naturally increase serotonin by eating healthy carbohydrates, because eating carbohydrate-rich foods increase serotonin in the brain. It's really cool. So this is not meaning eat sugar, right? When I'm saying healthy carbohydrates, you want to really get all your carbohydrates from vegetables. But carbohydrates are, fruits, they're grains, they're sugars. And so people generally way overeat carbohydrates, and that really disrupts blood sugar balance. But eating fiber-rich carbohydrates in the form of veggies is really important. And so if you're really wanting to maximize brain health, prevention of disease on all fronts, but particularly for your brain, a ketogenic lifestyle can be key. Research shows that ketogenic diet reverses the effects of mitochondrial dysfunction, which is common in mental health disorders and in low energy and in brain fog. And for sure, it's a connection then with depression as well. And while we don't always label it as such, pretty much every person who works with us is working on lowering their carbohydrates and increasing their good fats. So we're pretty much moving every client more towards a ketogenic lifestyle. And that's what we call a healthy ketogenic lifestyle, because there are ways that it can be done that can be very unhealthy. And then we do have a program for people who really want to dive in deep, and I'll speak more about that in a moment, to be really specifically knowing they're doing the keto lifestyle. But before I talk about that, let's talk about supplements to aid symptoms and to help people feel better in the moment while they are working on all these bigger themes. So I have a favorite formula called Neverton Forte. It contains skullcap and St. John's wort, schisandra, and saffron. And I use this product all the time to support healthy nervous system and support the mood. I find it helps people calm nerves, restore their balance with mood swings, and balance, overall a balance between the mind and the body, and support their sleep cycles as well. And I use this a lot for when people are feeling depressed, anxious, not sleeping well. Kava Forte, also from MediHerb, contains kava root extracted 100% with water. This is a strong relaxer and calmative, great sleep aid, and also just supports tension that comes from stress in the body. Rhodiola and schisandra is a combo of two of my favorite adaptogenic herbs. So adaptogens are a category of herbs that help the body cope and adapt to stressors in day-to-day life. And the longer you take them, the more they serve you. And so this is another one that I reach for when people are feeling overwhelmed, dealing with a lot of stress, experiencing changes in their mental health due to that. It's a tonic for the entire body. Rhodiola combined with ginseng, also from MediHerb, is another adaptogenic tonic that has the ginseng in it, which is more specific to when people are really struggling with low energy and lack of mental clarity, and have the cognitive piece more to their stress and overwhelm as well. Bacopa Complex is my favorite brain tonic. So it contains Bacopa, Schisandra, eleuthero, which is a ginseng, and essential oil of rosemary, and has definitely been shown clinically to enhance mental clarity, support healthy cognitive function, support healthy brain function long-term, support memory. But because of some of these other adaptogens in it, also supports endurance, stamina, stress relief, and concentration. Ashwagandha Complex is an herbal complex that I use a lot. I would say ashwagandha is one of the first adaptogenic herbs that I reach for, particularly because I work with so many women, and it has such benefits for hormone balance, for thyroid health, as well as it's one of these adaptogens that the longer you take it, the more it's with you, the more it provides that support for overall stress handling and providing that support for adaptability in day-to-day life. Mnchex is a whole food formula from Standard Process that I would say is one of our clinic's best sellers. It's a great combo of foods and minerals that acts very quickly to support emotional balance, supports the adrenal glands, which are vital for our stress response. It's a source of B vitamins as well. It's one that people just carry with them and take acutely in the moment when they're feeling stressed, overwhelmed, anxious, but also can help rebuild a body and rebuild the key nutrients and minerals that are missing, that have been contributing to the body being out of balance and having these symptoms in the first place. Mnchex I consider a even stronger version of Mnchex. It contains the Mnchex formula in it. And it's some stronger hormonal support, stronger adrenal support, and is really for when people are being very highly pushed in their life. And I reach for it then for support with emotional balance, mental clarity, stress handling, and that really hitting a wall with overwhelm. Mintran is a combo of 3 minerals, calcium, magnesium, and iodine, but in a very specific formulation and form that is incredibly helpful when folks are struggling with depression. It's a great sleep aid, and is something I use long-term, and I also use acutely, and is one that I reach for very often. And then BC-ATP is a very new product from Cellcore, specifically geared to supporting and boosting the mitochondria function. And our mitochondria, as I said before, create our cellular energy. They create our ATP. So when we have more ATP production, we have more energy. And this product really turns the brain on. And it's the one that I will be raffling off at the end of today. It's exciting because it's quickly become my new favorite. I find that clients see quick results with their brain turning back on, improvement in cognitive function, mental clarity, focus, improved energy, improved stamina. But also a key thing, because I've been reaching for this product with a lot of clients struggling with chronic health concerns, is that supports the mitochondria in such a way that their bodies are able to move forward with healing. So I have a client dealing with chronic Lyme and chronic mold who a lot of her symptoms are neurological symptoms. And she's been on this 2 weeks and she was like, the lights came back on, right? She's able to function on a day-to-day basis so much better. And then with the nutritional response testing, we see her body progressing faster. So I'm very excited about it. And so to shift gears away from supplements, I want to talk about tools that you can take advantage of to address all the issues that I've been speaking about today in terms of why our brains get stressed so much, why our own brain reserve gets depleted so quickly, and how we're all dealing with different levels of neuroinflammation, how we can combat that, right? And so one tool that we've had in the office now for about a year and been seeing fantastic results is the Ion Cleanse Detox Foot Bath. I see this as an essential way for people to stay on top of the toxicity burden that we get exposed to. I educate people to avoid as many exposures as you can through your food, your water, your skincare products. But there are still things that we cannot control. And so through supplementation and through the Ion Cleanse Detox Foot Bath, I've seen people really successfully be able to get on top of that toxic burden and have it not impact them in such negative ways. It's very relaxing. You sit with your feet in warm water. You do that 30 minutes. It's optimally done twice a week for at least 3 weeks to see how your body progresses. But in general, it's recommended that you do as many foot baths as how old you are. And then here's Ryan and our nutritional coaching and healthy keto weight loss program. This is a really exciting program that we have been doing now, gosh, 6 months, maybe longer. Ryan works with folks one-on-one virtually and teaches you really how to do the keto diet in a healthy way, and to really understand what that means to be in ketosis and how you need to eat, and to witness the health benefits that can come from it, right? Which can, improved brain function, improved energy, weight loss, improved mitochondrial function. I think a lot of people have a lot of misunderstoods about keto or think they're doing it. But it's really eye-opening once you work with Ryan and realize how to do it properly and then how to actually benefit from it. And then, of course, there's the nutrition response testing program. And of course, this is my role, my work, and my love. I want everyone to know about nutrition response testing and to benefit from it. It's a non-invasive system to assist the practitioner's assessment of the underlying causes of ill health in a person. I use neurological reflexes and ask the body different questions about what barriers are there to healing. Is it the glyphosate? Is it gut flora imbalance? Is it a food intolerance? If we ask all these different types of questions and get to the root cause for why the body is out of balance and not functioning optimally. And so if you're not local, I highly recommend that you find someone near you who does nutrition response testing. And if you are local and you haven't come into our office for initial assessment yet, please do, because it'll be a perspective and feedback on your health that I think will be very unique and will help you address your health concerns and take them to a new level. All right, so here's how you can contact me at the Nutritional Wellness Center. Thank you so much for joining me today. I really hope that you found it helpful and some tools so that you can master your own brain health.